Hi everyone, my name is Susana Huang. I'm a family doctor in Toronto. Today is March 28, 2021. I will be sharing about the COVID-19 vaccines. This presentation does not replace consulting our own family doctors and also paying attention to government guidelines in terms of the current news and the most recent updates. So please use at your own discretion. It is up to date as of March 28. As outlined, first I will talk about what is the COVID-19 illness. Second, how immune response to natural infection differs from vaccination. Then details about the vaccines, and then who should get the vaccines and who should not. And then recommendations on what to do after the vaccine. And last, how to register for vaccine. The first reports of COVID-19 was from Wuhan City in China at a seafood market where a cluster of cases were identified around November, December 2019. And then in February 2020, the World Health Organization named it COVID-19. And then March 11, 2020, the WHO declared it a pandemic, a global pandemic. Now on March 25th of 2021, there are 125 million cases of infection around the world, 900 or so thousands in Canada, and daily in Ontario, we're still seeing more than 2,000 cases. The distributions of severity after contacting COVID-19 are as follows. 81% have mild illness, so no symptoms or no or mild pneumonia. About 20% of total will have no symptoms. And then 14% have severe diseases, difficulty breathing, pneumonia greater than 50% of the lung, and oxygen in blood less than 50%. 5% are critically ill with lung, heart, and kidney failures. And then about 1 in 2 of these will die, so a total of 2.5% of deaths. So what are COVID-19 symptoms? So we have runny nose, cough, sore throat, diarrhea, nausea, vomiting, headache, fever, muscle ache, shortness of breath, pneumonia, loss of sense of smell, loss of sense of taste. And of course, as this is a new illness, we're still learning a lot about symptoms, but these are the more kind of common and general ones. In terms of what causes these symptoms, I would like to ask everyone to take a minute to think about this. Is it the COVID-19 virus or is it our immune system? So the correct answer is actually our immune system. So just as how wonderful it is for our body to grow and develop from one fetal cell to the whole human body, so every single cell inside the body also has a purpose, and it's amazing how it works, fits together to make our body works. In terms of our immune system, we can break it down into two sides. One side is the innate immune system, which is the frontline defense system. It fires at the invader and then causes damage to the whole area. And then the adaptive immune system is the other side, where it consists of specialized troops, and they will kill specifically at the invaders. And these two systems are regulating each other and also communicating with each other. So the innate immune system works well for a situation like this. For example, if we get a cut and bacteria kind of comes in from that cut, it starts an inflammatory response in the area that kind of closes off the area so that bacteria cannot access the rest of the body. However, for viruses, this doesn't work very well because by the time the innate immune system sees the virus already entered the body and has reproduced inside the body, so it's everywhere. So the inflammatory response will also be everywhere, and as it increases, it will damage the body, causing symptoms of illness. For example, the symptoms that we saw before. So we can see that inflammatory response can be a good thing and also a bad thing. It can serve as a signal to activate the specialized troop, the adaptive immune system as well. The adaptive immune system, once activated, it will kill the virus specifically, and also it will decrease the inflammatory response by regulating the innate immune system. And then it will develop memory so that the second time we see the same infection, it can act quickly and destroy the infection very quickly. So some people might wonder, why do we need vaccines if we have this amazing immune system that can kill the virus or treat the infection? We're going to look at what happens to the immune system with natural infection versus vaccine in the following graphs. So when we first time we get an infection, our body develops this inflammatory response from the innate immune system that kind of increases, and when it passes a certain level, will develop symptoms of illness. As this increases, it activates the adaptive immune system, both cells and antibody, and will decrease the inflammatory response as we saw earlier. And the adaptive immune system doesn't go down to zero. It will stay in our body, sort of creating what is commonly known as immunity. So that the second time we see an infection, the same infection, this immunity can provide us protection, can act quickly to treat the infection and prevent the inflammatory response to rise past the illness threshold. When we see vaccination, when we get vaccinated, we also develop a little bit of an inflammatory response, but usually this is not big enough to cause us to feel ill. So like localized swelling, a little bit feverish, that lasts for 1 or 2 days kind of thing. But this is usually enough to allow the adaptive immune system to be activated so we can create antibody. We also have cell memory so that the first time we see an infection, the immune system can act quickly to destroy this infection, and we don't actually develop inflammatory response to cause us to feel ill. So this is just in writing of what we saw in the previous graph. So I think both the immune system as well as vaccines are great help when we are in this time of trouble being attacked by viruses. And as a Christian, I'm always reminded that God is our refuge and strength and an ever-present help in times of trouble through the things that I learn about every day. So now we're going to move on to learning about the details of these vaccines. So the vaccines that are authorized for use in Canada as of today, we have 2 categories so far. The mRNA vaccines, which are the Pfizer, BioNTech, and Moderna. I will call the Pfizer, BioNTech as Pfizer from here on. The viral vector vaccine, Oxford, AstraZeneca, and the Johnson Johnson, or I will call AstraZeneca and Johnson Johnson from here on. They were approved on these dates, and then all of the vaccine can be used for greater than 18 years old, except for Pfizer, which can be used for actually greater than 16 years old. And the Johnson Johnson is a 1 dose, the other one are 2 doses. In terms of effectiveness, the mRNA vaccines are 85 to 95% for preventing infection. The viral vectors ones are around 60%. But if we look at our annual flu shot effectiveness, it's around 40 to 60%. So the COVID vaccine that we have are very, very, very effective in comparison. And I guess what we really care about is preventing severe diseases, for we know mortality comes from those who get really ill from it. And the Pfizer give us 75 to 100% protection, Moderna and AstraZeneca 100%, and the Johnson Johnson 86%. So even at the lowest one, which is 75%, is still much higher than the regular flu shot. And in terms of effectiveness period, the short answer is that we don't know. But if we want to look at the original study, they were monitored for this period of time, as we can see on this chart. But from actually knowing, the knowledge of the immune system that we talked about earlier, usually we do have antibody lasting for a longer period of time. The only thing about the COVID-19 illness is that we don't know how much antibody or how are the cell activated that much yet, because it's a very new disease. And then now we're going to look at how each vaccines are about. So first, we're going to look at the structure of this mRNA vaccine and how it works in our body. So when we have the COVID-19 virus, the scientists know that they use this protein on the surface called spike protein to enter human cells. So they change this protein into mRNA and then wrap it inside a lipid shell and use that to transport into our body and also to, preserve the mRNA. So the vaccine consists of a lot of this lipid particle with mRNA inside, and it does not contain any virus. When the body becomes vaccinated, the mRNA can get into the cell and instruct the cell to make spike protein. And when our immune system ceases, it will develop memory and also cell immunity to attack the virus when they see the COVID-19 virus, which has this protein on the surface. So mRNA, some people worry about it becoming DNA or affecting our DNA, but we know that mRNA is destroyed regularly in the body after use, and it does not get changed into DNA. We don't have the mechanism to actually do that in our body. And for viral vector vaccine, they're basically using the same spike protein, but instead of using mRNA, they create a vector, a viral vector, which is in this case a adenovirus in both vaccine. And the adenovirus usually does not cause illness in human body. As well, the adenovirus does not replicate, so it doesn't have the ability to make copy of itself in the body and cause illness. But it will have the ability to express the spike protein on its surface. So when our body sees this viral vector, it will be able to stimulate the body to make antibody and also cell immunity to attack the virus when they seize it. In terms of the COVID-19 variants, we know that we have four. The one that started in Brazil, in California, in South Africa, and also in England. We don't actually have real time data, as in what happened after people get vaccinated and then how that kind of affects the spread of the variants. But we do have laboratory data where we use the antibody from people who get the COVID vaccine and then try to neutralize the virus, the variant virus. And it seems that we have decreased immunity against the variant, especially the South African one. But as we saw earlier, the immune system, once it's activated, doesn't only create antibody, but there's also cell-mediated kind of immunity. And we just don't know enough to say whether the vaccine is truly less effective against the variant so far. And there are many vaccines still being developed, and even the vaccine that we currently have, the companies are trying to tweak them to make them work better against the variants. So, changes are just happening all the time, and we have to pay attention to the news as to how they, how they can work better for the variants at this point. But in terms of what we know so far, we know that if we can, the best way to stop the spread of the variants actually to get as many people vaccinated as possible, so that there's no more kind of rise of variant. And even if the vaccine give us less protection against the variant, at least it will give us some. If we don't have the vaccine, then we might not even have that little bit of protection. So the recommendation is still to get the vaccine at this point. Some people wonder if the vaccine are actually developed in a haphazard way because the development happens so quickly and usually takes longer to develop them. But from actually looking at the studies, we know that no step were skipped in the development of these vaccines. And for clinical trials, phase 3, usually we use 6,000 to 8,000 people to do this part, but all of the vaccine developers used between 20,000 to 40,000 people to do the studies. And because there's so many resources from governments and from the scientific community kind of invested into the whole process, it just happened more efficiently. But also there are interests from many countries in terms of monitoring adverse effects and safety issues that they are actually updated regularly and can be easily accessed to the public. So we actually can have data about, whether this vaccine has more adverse effect than other vaccines. So we can look at data from March 19. And so far, up to that day, we have given out 3.7 million vaccines. There's no safety concerns. Mild reaction reported were about 2,000. Severe reaction about 300, and that's due to vaccine 0, under investigation 0. So in terms of vaccine adverse effects, we have a table here. So the pharmaceutical company suggests that 1 in 10 people would develop injection site pain, redness, swelling, warm, itchiness. As we know, these are common side effects of all vaccines, okay? And headache, nausea, vomiting, diarrhea, fever, and muscle aches are probably more, they're pretty common too, but 1 out of 100, which is a little bit more rare, for example, hives, which is kind of like an allergy, could be allergy related. Large lymph node is a little bit more specific to this vaccine. Dizziness, increased sweating, and no appetite are also more specific to these vaccines. But the last 3 have not been seen as in being reported by the Canadian monitoring system, but they were suggested by the manufacturers. In terms of reported rate after use, for these are all under mild reaction, and there's about 0.059%, so it's less than 1 in 1,000. The company suggested a more rare side effect is about 1 in 1,000 is anaphylaxis, which is severe allergic reaction. So difficulty breathing, hive everywhere, and this is an emergency. In real life observation, severe reactions about 1 in 10,000. So it's actually less than suggested by the manufacturer. In terms of timeline of adverse effects, as we saw earlier, mild reaction usually occurs less than 7 days and lasts for less than 3 days. And we can treat them as with other, vaccine side effects using Tylenol Advil, Benadryl, and those kind of thing. There is some kind of more specific adverse reaction. For example, the Moderna vaccine can give injection site redness, swelling, pain, itch, and warmth after 8 days and lasting 4 to 5 days. So, of course, if we see any reaction that's more than usual, we can report it to our doctor. And in this case, we should definitely report, as we're still trying to learn more about the vaccine and what kind of side effects it can generate. But this is still considered sort of localized and mild. Anaphylaxis is difficulty breathing, facial swelling, hives, and usually happens immediately after vaccine. So that's why we recommend everyone to stay for at least 15 minutes after vaccination. And for people who have certain medical condition like allergies to other things, we recommend them to stay for 30 minutes because anaphylaxis, as severe as it is and as an emergency, it can be treated effectively with medicine that we have. So in the emergency room, we treat this all the time. The only thing is that if it happens like later, we still need to seek medical attention immediately, like call 911. So after we get a mild reaction, we can treat with any over-the-counter medication as usual, but we would not recommend at this point to use those medication as a prevention method. So use it before the vaccination, because we do want a little bit of immune response to activate our immune system. Like we want some sort of a little bit of inflammation. But once we get the inflammatory response happening, now we can take medication to stop it if it's starting to bother us. As I said before, rate of adverse effects is similar to other vaccines, but of one particular concern recently is the AstraZeneca vaccine and blood clots. So I'm going to use some really conservative numbers here. So far, we have around 37 blood clots cases reported among vaccinated people. And if we use 11 million vaccine as the number of AstraZeneca given around the world, it's actually more than this number. When I prepared this slide, the largest number that I saw was 20 million, but we will use 11 million as the most conservative one. And we'll also make it even more conservative by assuming 2 vaccine per person. So we're going to try to make this blood clot rate as high as possible. And we have this number, and we're going to convert it into, 1 per how many persons. And this is about 1 in 148,000, which is less than 1 in 100,000. The reason why we use 1 in 100,000 because the spontaneous, for example, spontaneous upper extremity blood clots, among other type of blood clots, is about 1 to 2 in 100,000 person. And the rate of blood clots in COVID-19 patients is 10 to 30% of severe cases. So the chance of blood clot in vaccinated people is not higher than spontaneous occurring cases in the general population. And if we get COVID-19, we will be at high risk of blood clots. So because this is, although rare, is a possibility, we should know what to look for signs of blood clots, because we can treat it effectively as well. So if we have difficulty breathing, if we have difficulty with stopping bleeding, so like more than usual, we are talking about. Some people might have a little bit on a usual basis because of taking aspirin or things like that, but we're talking about like more unusual ones. And then headache or blurry vision lasting more than 3 days, or new onset seizure, chest or stomach pain, arm or leg swelling or cold sensation, and multiple small bruises, red, purple spots, blood blisters. If we have these symptoms starting 4 to 20 days after vaccination, so we should watch for these symptoms for up to 3 weeks after vaccination. At signs of them, we should definitely contact our doctors. All right, so we are almost halfway through learning about the vaccine. I'm a Christian, so I do believe that there are a lot of knowledge out there, and knowledge is a little bit different than wisdom. And I believe that God guides me in terms of how to prioritize through all the knowledge and information that I learn every day. And I hope that this presentation doesn't only, help everyone to acquire more knowledge, but also ways to sort of prioritize it and to make your decision making a little bit easier as well. All right, so now we're going to look at ingredients for COVID-19 vaccines. So the Pfizer vaccine, we know is mRNA wrapped by lipid particles. And basically the structure of the vaccine is mRNA, the lipid particles, salt, sugar, and water to keep the vaccine during transport and storage. And I have a table of what each chemical is commonly found in, as we are usually not very familiar with these names. And of particular interest is the PEG found in this vaccine, as we might have heard on the news about people being allergic to PEG. But this is found in a lot of non-prescription medication, and we'll see which are those. And then the Moderna vaccine, similar structure, but of course different chemical used. And this one also has a different kind of PEG, as well as something called thromethamine, which is actually found in some pain medication and eye drops. So for PEG, it's found in Tylenol, Reactin, Benadryl, aspirin, and laxatives. So this means that if we had any of these medication without developing allergic reaction, probably means that we would not develop an anaphylactic reaction to PEG. All right. So for the AstraZeneca vaccine, it's a viral vector. So that means the adenovirus expressing the spike protein on the surface. And then that's the active ingredient, and the rest are just kind of to stabilize the solution. And one of the ingredients is polysorbate, which is found in ice cream, frozen dessert, cosmetics, but it's also, as we see later, has some cross-reactivity with PEG, and it's also a source of allergic reaction trigger. The Johnson & Johnson vaccine also has polysorbate, among other things. And I also have a table of what each chemical is commonly found in. So when we get the vaccine, they will ask us if we are allergic to PEG, polysorbate, and also the other component that I saw earlier, the tromethamine. So they will ask us for allergy to those things. And if we have those allergy, then we probably cannot get the vaccine. So in terms of the COVID vaccine, it does not have mercury, aluminum, formaldehyde, egg cells, or fetal cells. All right, now we're going to look at who can get the vaccine and who should not. So absolute contraindication are those who cannot get the vaccine. They are people who have anaphylaxis, severe allergic reaction to the vaccine or any of its components. So polysorbate, thromethamine, PEG are some of those components among other ones. And people who had one dose and then developed severe allergic reaction probably should not get second dose of the same vaccine. And if they really need to, because they're at very high risk, they need to see an allergist and be clear by them before they can get the vaccine. If anyone had another vaccine within 14 days, so this does not include allergy shots or getting your blood drawn at the laboratory. These actually are, vaccines that are included in here. And then anyone who have active COVID-19 symptoms or illness cannot get the vaccine until they are recovered from their condition. And then people who are outside of the age range, so less than 18 or less than 16 for Pfizer. But research are being done by all the companies to try to lower the vaccine age to 12. And we will have to pay attention to the news for when the results will come out. Precaution are those people who should probably be careful or take some precaution when they get the vaccine. So one of the common one is bleeding problems. So some people might be on aspirin, they might be on blood thinners. For these people, it's really after they get the vaccine, there might be problem with the bleeding from the injection site. But usually by applying pressure for longer is enough. So applying for 3 to 5 minutes or applying for a little bit longer is enough to treat this. And it's not specific to the COVID vaccine, the precaution. And people with history of fainting, again, some people with any medical procedure, especially with vaccination or drawing blood, will faint. For these people, they might need to get the vaccine lying down on a stretcher. Again, this is a general precaution and not specific to the vaccine. For people with allergies to medication, environmental stuff, insect venom, they should stay for 30 minutes instead of 15 after vaccination. Again, this is also a general precaution. For people with a weakened immune system, because their immune system might not respond well to the vaccine might not be as effective. Sometimes people might be taking medication that are making the vaccine, making the immune system less effective. So the vaccine will not be effective if given at the same time. So for these people, they should talk to their specialist or the treating physician for that condition. For example, if they have cancer, they should talk to oncologists or rheumatologists or neurologists or anyone who's treating them to see when they should get the vaccine, how to time it with their medication, and whether they qualify. But having a weak immune system does not mean that they should not get the vaccine, because if they don't, they have no protection at all. But if they get the vaccine and the vaccine does not work as well in them, at least they get a reduced efficacy of protection, a reduced level of protection. But no vaccine means no protection. And for people with a weaker immune system, they are at higher risk for severe disease. The other group is pregnant and breastfeeding women, because the original study did not include this kind of people in the study. We don't know if they can cause harm or not, if that's safe to use for them. But considering the mechanism of the vaccine not containing any live virus, it should be safe for use for this population as well. But they need to have a discussion with the treating physician regarding the risks and the benefits. And we do know that pregnant individuals, as well as nursing infants, so infant less than 1 year old, are at increased risk of severe disease of COVID-19. So they should benefit more from the protection by the vaccine. Of course, they need to weigh it against the risk of not knowing yet what this vaccine, like if they're safe enough for them to use. And a lot of the companies that produce the vaccine actually are doing studies right now, including the pregnant people and breastfeeding people, to see if there's any side effects or adverse effects that are out of ordinary with the vaccine in them. People who have anaphylaxis to other vaccines or mild allergic reaction to the COVID-19 vaccine, so developing runny nose, nausea, vomiting, hives, diarrhea immediately after getting the vaccine or within 4 hours of getting the vaccine, they should probably talk to an allergist before getting COVID vaccine of the same type again. In terms of after COVID infection, whether we still need to get vaccine, we know that some people with mild symptoms of COVID-19, they don't really have a lot of antibody after the infection, and we don't know if they have protection and how long does the protection last. So we do recommend everyone, even if they already had COVID-19, they should still get the vaccine afterwards, but they have to wait until the infection is over. And right now we are able to do the vaccination for anybody right after the infection. But if some people who had the infection and they want to wait a little bit longer, it's possible that we have antibody for at least 3 months. But of course, this is not currently known as to how long we can wait for. So if it is available, you should get it immediately. How to register for vaccination? There are actually a few different routes to get registered. So the public health vaccination clinic are the ones that we always hear on the news, and there's this central website that we can register. You can also check your nearest hospital website, the pharmacist near you. You can find a list of pharmacies on this website, but I think it's probably better if you directly go to the pharmacy website, because this website does not really exclude the pharmacy that don't have the vaccine. They just list all the pharmacies in Ontario for you. And then you can also ask your doctor, even if your doctor might not have the vaccine, they might have connection to refer you to clinics that are nearby who might be offering the vaccine. For people who don't have health card or who cannot do online booking, they will probably be able to use the phone line. There are sometimes reports of long wait time over the phone. So if you have family and friends who can help you register, you should try to do it online, for that's actually relatively easier. Currently, we do need to be in a priority group to be able to register, but this is constantly changing, and there are constantly moving forward of including more people to be able to get the vaccine. So you should pay attention to the news to constantly update on that. After vaccination, we still need to wear a mask, wash hands, and keep 2-meter distance when we are with other people, especially who are not vaccinated and who are not of the same household. This is because we need to get around 40 to 90% of the whole population vaccinated before we can have herd immunity, which is protection for those who are not vaccinated or those who have a weakened immune system, so the vaccine does not work as well in them. And right now, as of last week, we have about 11% of the whole population vaccinated. Here's the reference of the information that we looked at today, and you guys definitely feel free to look at it if you have time. Again, we should not just based on this information, especially as time pass by, we need to probably pay attention to the news and also to newer development and consult our own doctors. So thank you for your attention, and hopefully you have not been as bored as my daughter has been.